In the news this week, we'll be covering new and upcoming FDA approvals. All that and more starts right now on OncLive News Network. Hello and welcome. I'm Laura Jones.
And I'm Justin Gallagher.
In FDA news, the combination of nativitant plus palonosetron, or trade name Akynzeo, has been approved to treat chemotherapy-induced nausea and vomiting. The approval was based on findings from two studies that examined the combination therapy in more than 1,700 patients. In the first trial, 77% of patients achieved complete responses with Akynzeo versus 69% for single-agent palonosetron for preventing nausea and vomiting for 25 to 120 hours after chemotherapy. For the first 24 hours following chemotherapy, the combination group prevented nausea and vomiting in 88.4% of patients versus 85% with palonosetron alone. Similar results were seen in the second trial.
In breast cancer news, the agency has granted priority review to palbociclib in combination with letrozole as a frontline treatment for postmenopausal patients with ER-positive, HER2-negative advanced breast cancer. Under this program, the agency's decision date will be April 13, 2015. The application for the small molecule inhibitor of cyclin-dependent kinases 4 and 6 was based on data from the Phase 2 open-label PALOMA-1 trial, which compared palbociclib plus letrozole with letrozole alone in untreated patients who were ER-positive, HER2-negative advanced breast cancer. The final analysis from this study, presented at the AACR meeting last April, revealed a 51% reduction in the risk of progression with the addition of palbociclib to letrozole. Median PFS was 20.2 months with palbociclib compared with 10.2 months for letrozole alone. Overall survival, which was 37.5 months with palbociclib and 33.3 months with letrozole alone, showed a trend in favor of the combination at the time of the analysis, with 63% of patients enrolled in the trial still alive. If the groundbreaking Phase 2 results hold up in the upcoming Phase 3 trial, palbociclib could become a new standard of care in the setting of ER-positive, HER2-negative metastatic breast cancer.
Also receiving priority review is blinatumomab for adult Philadelphia chromosome-negative relapsed or refractory B precursor acute lymphoblastic leukemia. The priority review for the bispecific T-cell engaging antibody comes following the breakthrough designation status earlier this year. The FDA decision date for blinatumomab is set for May 19, 2015, and supporting data which were presented at the 2014 ASCO annual meeting, 43% of patients with relapsed or refractory ALL who were treated with blinatumomab achieved a complete remission or a complete remission with partial hematologic recovery. The median age of patients was 39 years old. 80% of responses occurred within the first cycle, and 74% of patients were minimal residual disease responders.
Next, the FDA has scheduled an ODAC advisory meeting for November 6, 2014, to review safety and efficacy of the pan-deacetylase inhibitor panobinostat. The expert panel will look at data on panobinostat in combination with bortezomib and dexamethasone, or Veldex, in patients with previously treated myeloma. In the Phase 3 Panorama-1 study, after a median follow-up at 125 weeks, panobinostat plus Veldex was associated with a median PFS of 12 months, compared with 8.1 months with Veldex and placebo. The final overall survival results for the combination are still pending. However, in an interim analysis, toxicity resulted in 36% of panobinostat-treated patients discontinuing therapy versus 20% in the placebo arm. In addition, the rate of grade 3 or 4 diarrhea and asthenia or fatigue was considerably higher with panobinostat.
Finally, the FDA has approved bortezomib for frontline treatment of mantle cell lymphoma. The decision was based on findings from an open-label Phase 3 trial that evaluated the VRCAP regimen, which replaces vincristine with bortezomib in the standard R-CHOP regimen. The study compared VRCAP with R-CHOP in patients with newly diagnosed transplant-ineligible mantle cell lymphoma. The results showed that the bortezomib-containing regimen improved PFS by 37% and overall response rate by 10% when compared with R-CHOP. After a median follow-up period of 40 months, the median PFS was prolonged by 10 months with bortezomib. Adverse reactions leading to discontinuation of therapy occurred in 8% of patients in the VRCAP arm and 6% of patients in the R-CHOP arm. The most commonly reported adverse reaction leading to the discontinuation of VRCAP was peripheral sensory neuropathy. It's thought that incorporating subcutaneous bortezomib may improve toxicity of this regimen.
To note, currently there is no standard comparator for mantle cell lymphoma. Bortezomib was already approved in the relapse setting, and several novel therapies are being evaluated for newly diagnosed patients. Drugs such as bendamustine, lenalidomide, and ibrutinib are among the agents being studied.
I want to thank you so much for joining us here at OncLive News Network. I'm Laura Jones.
And I'm Justin Gallagher.
Thanks for watching. We'll see you next time.